So I've seen most of you guys' faces are more familiar than names, but they can leave me tonight over here. We're going to do a couple of kind of short topics because my attention span's probably as short as yours. Has anybody gone through the new brew stuff or heard about it? No? Good. All right. So, who knows what an ALTE is? Anybody? Go ahead. Okay. Do we still use that term? Or is that outdated?
I think it's outdated. I think they changed.
Yeah, we changed. So it's just going to go quick. I will just introduce this new topic for you. So we're really not going to talk about ALTE at all today. That was an apparent life-threatening event. We're going to talk about brief, resolved, unexplained events. So it's just a brand new name with a different kind of category for this. All right? ALTE is no longer really a thing. We don't really use that at all anymore. All right. So, in order to fall into this category, you have to be less than 1. All right? Yeah, you have to have either cyanosis, pallor, those kind of things. Absent, decreased, or irregular breathing. Marked or change in tone, or altered level of consciousness. So you really need to be less than 1, you need to have 2 of the others. Okay? And really the only thing that you can say is that it's got to be an unexplained event, right? You can't say that they've had a viral illness for the last 2 days, but they all of a sudden became cyanotic, they look sick, those type of things. Because we're no longer using ALTE. ALTE used to encompass all of those things. But if you have some sort of explanation for it, it no longer falls into that category. So what's really changed? Like we talked about, greater than 1 of the following. Used all of these. All right, so they took out this part, an episode frightening to the observer. I'm sure all of us have walked into a house and mom, dad have been extremely concerned about what the kid looks like or what the kid did look like, but the kid looks absolutely fine. All right, they took that out of there because it's extremely subjective and kind of gave more of a general strict guidelines for what it is. And before they kind of characterized it by apnea, which is pretty much the same thing. Cyanosis, pallor, absent or decreased irregular breathing. Color change, those are pretty much the same. Change in tone, it's pretty much the same. And choking or gagging, they actually took out, because choking or gagging can be a lot of things to a lot of people. It's not always kind of dry too. So really they're just shifting around the definition just a little bit. And it does actually change the way that we do it inside the hospital, not so much for what you guys are going to do, but it does change it. Alright, so they change all these things every couple of years, and it's really, you ask why does it really matter? More or less because at the end of this, which I won't really talk to you guys so much about, they have a lot of different evidence-based things for how to care for these kids, what tests to order, what tests not to order. Doesn't matter as much to you guys, but we'll kind of talk about the brief stuff beforehand. This is my nephew. He's going to help us out a little bit. So, the American Academy of Pediatrics, in their objectives, basically did they want a better name? Did they want something that was easier to remember? Tough to say. It's really what they're trying to do is they're trying to separate it into 2 different categories, either high risk or low risk, which ALTE never really had. And it's more of who's going to have a secondary event rather than how sick the kid looked at the time. And like I was saying, they offer some evidence-based medicine recommendations for the low-risk patients, and the high-risk patients all get admitted to the hospital. All right. So some of the issues that they have with ALTE, most often these kids are very asymptomatic. It's tough to really tell what's going on. And we talked about it's very concerning to parents, but not necessarily life-threatening. And some of these things kind of went into the old category of ALTE that no longer are in the new BRUE stuff. So periodic breathing in the newborn, really to get a respiratory rate in an infant, you have to do it over a minute. Because they do have periodic breathing, they will kind of increase their rate and then decrease all within 60 seconds. Breath holding spells, kids do it all the time. Kids with dysphagia problems who are choking, gagging, it's really not considered an ALTE anymore because most of the time they have some sort of underlying congenital anomaly that's causing that, whether it be a tracheal esophageal fistula or something like that. And then reflux, which a lot of kids have and a lot of kids are treated for. We would call it reflux, we're not going to call it an ALTE. So this is kind of my way of looking at these kids when they come in. Because you walk in, you hear this really terrible story, you work them up, and then you just kind of get nowhere, right? Like, that's why it's unexplained. They end up sitting in the hospital for a while, and there's really nothing else to change about it. So we'll kind of go through the different components real quick. The brief part of it, typically these last 20 to 30 seconds. If it's lasting more than a minute, it's really not under this category anymore. And they have a reassuring history exam and vitals. The resolve part here, they have to return to baseline. So if you show up on scene and these kids still look like crap, it's not a brew, it's obviously something else. And they have normal appearance when the health care provider gets there. So this excludes anybody who's really got fever, quick breathing, fast heart rate, any sort of mental status changes, hypotonia, vomiting, bruising, any of these things are no longer under this category. So, anybody, can a brew present with infectious type symptoms? No, right? As if it has any sort of infectious symptom, it's due to an infectious process. It's an explained thing. So, talked about no identifiable medical cause, and we're no longer really putting in reflux. A lot of times these reflux kids, they start to spit up, they get something stuck in the back of their throat, they look like they're pale, cyanotic, most of the time they're beet red, but we're putting it under a totally different category. Nasal congestion is another one. Infants, realistically when they're feeding, they need to breathe through their nose. So if they have a URI or they're sick, they can't breathe if mom's trying to feed them. And a lot of times you'll get the history that, oh, I was feeding them and they started to cough, they started to gag. But they don't breathe through their mouth that way. They're obligated nasal breathers. And one of the biggest things that you guys do a great job of, and really that's the only way the healthcare provider is going to get the information, is if you guys are worried about child abuse or you see something in the house, you see something that's out of place, you got to let us know, because that's another huge thing here. All right, choking and gagging, it's no longer in brew, it was in ALTE before. All right, and then these events. What does fall in the category instead of what doesn't. Like we said, anything with cyanosis or pallor, central cyanosis would be the face, gums, trunk, okay? Central pallor, obviously whiteness of the face or the trunk. It's not an actual picture, it's just a Google image. It excludes aprocyanosis, so that's what this is. It's purpling of the extremities, or you usually see it in the hands or the feet, all right? It typically goes away. Most of the time it's due to some sort of stress response. Your vessels clamp down a little bit, they don't get perfused as well. This is perioral cyanosis. It's different than central cyanosis. So if you see their upper lip is purple, well, it's really not the lip, it's right above the lip, it's purple. That is not actually a central finding, it's something that's pretty benign. And just rubor of their cheeks, that's not included either. All right, so their breathing. Central apnea is something that you'll see often, most likely in winter, because it's really caused by bronchiolitis, RSV a lot of times. There's a couple other things that can cause it, such as metabolic disorders, but most of the time you'll see it in winter time. Obstructive apnea. There are kids who obstruct their airway just when they're laying down on their back. That does happen. Sometimes you can see large tonsils with that and adenoid problems. And like we talked about, it excludes that periodic breathing of the newborn and breath holding spells. So the change in tone is something that you guys, again, really shouldn't see, but parents will kind of tell you, because it should be resolved by the time you get there. So when it doesn't incorporate, so it's part of the history too, of the kids crying, choking, gagging, obviously they're going to have increased tone, right? They're going to kind of tense up a little bit. due to the breath holding spells. You know, if they have seizure activity, obviously that's not, you know, categorized in the BRUE category. Mental status changes, you know, they should have resolved by the time you got there. Postictal phase obviously is not included within BRUE. And sometimes kids can actually make themselves pass out. They'll start breathing again, but they can do that. So like we talked, what we're trying to do is trying to tease out these low-risk kids from these high-risk kids. Before, anybody with an ALTE pretty much got admitted to the hospital and put on monitoring for 24 hours. And found that in kind of the evidence-based literature that you really don't need to do that. And a lot of these kids who are low risk potentially could go home. The high risk guys, you end up calling the pediatric admitting officer. They all stay. But it's kind of difficult to stay away from this. All right, so any of the high risk ones, these are the kids who are gonna end up staying in the hospital. They're less than 2 months, they have a history of prematurity, or if they have more than one event. And then, to be low risk, you have to meet all these criteria. You gotta be, should be less than 60 days. Or sorry, greater than 60 days. Gestational age, you have to be greater than 32 weeks. Post-conception age, 45 weeks. It's gotta be the first time they ever have a BRUE. You know, if they have a second BRUE event, they'd be high risk automatically. And it's gotta be less than 1 minute. No CPR required by a trained medical provider. So they check out parents because obviously parents might start CPR on a kid and really not needed to. And then no concerning historical features and no concerning exam findings. Obviously, if somebody receives CPR, they don't qualify. All right. So that was just a brief overview of something just because that recently changed. We won't go over the rest of the stuff for the in-hospital management, but does anybody